Hypertensive disorders of pregnancy, also known as HDP, is one of the leading causes of adverse birth outcomes. HDP can lead to preeclampsia, which can be diagnosed during pregnancy, during labor, or up to 6 weeks postpartum. African American women are more likely to develop HDP because they are less likely to start receiving prenatal care during their first trimester of pregnancy due to fear of being mistreated. Women who start receiving prenatal care early have a better understanding of the adverse outcomes that can occur when being diagnosed with HDP. They have also improved birth outcomes as well as less complications. Over half of all U.S. women of reproductive age are overweight or obese. Geographic location plays a role. African American women who live in the South are associated with having a higher risk of weight gain due to higher levels of poverty, unemployment, and lower education population. Postpartum weight retention has been increasing over time, which increases adverse outcomes. Some of these outcomes include a greater risk of developing gestational diabetes and obstetric complications such as the need for a cesarean delivery, macrosomia, and going into preterm labor. GDM is a common pregnancy complication. African American women have a higher risk of developing GDM compared to non-Hispanic white women. A study showed that 20.4% of African American women later developed type 2 diabetes compared to only 12.1% of white women. A study was conducted to determine if socioeconomic status, race and ethnicity, and prenatal cardiometabolic diseases such as preeclampsia predict postpartum cardiometabolic risk. At 6 and 12 months postpartum, 4 biomarkers were checked: mean arterial pressure, glycosated hemoglobin, total cholesterol, and waist-to-hip ratio. These biomarkers were combined to complete an average postpartum cardiometabolic risk index. Conclusions showed that African American women emerged as a vulnerable group. There have been studies noted that non-obstetric factors such as car accidents, overdoses, homicides, and suicides are accounting for a large proportion of maternal death. From 2000 to 2019, there were 7,334 women that died during pregnancy, childbirth, and within 42 days of childbirth, all from non-obstetric causes. African American women were found to have the highest risk of these non-obstetric maternal death rates. Structural racism is viewed as the root cause of racial and ethnic disparities in maternal health outcomes. Results show that African American women have significantly increased odds of severe adverse maternal outcomes, such as blood transfusions, hysterectomies, and ICU admission. Addressing racial and ethnic disparities in severe maternal morbidity and maternal mortality have been recognized as an urgent public health priority. Compared to white women, African American women are up to 3 times more likely to experience severe maternal morbidity. African American women experience maternal death at a rate of 3 to 4 times that of a white woman. Community-based organizations provide social support services that are critical in addressing the needs of clients of color during and after pregnancy. A study showed that social support services of housing and childcare are the 2 areas that require increased attention and funding. A study was conducted with 18 African American women who were publicly insured who gave birth between June 1, 2019 and May 1, 2020. They were divided into 4 focus groups. The study focused on postpartum experiences of African American women with the objective to identify areas for intervention to reduce postpartum ER usage. African American women are more likely to have an ER visit after delivery, as well as a 2-fold increase risk of postpartum hospital readmission compared to white women. Of the 18 women in the study, 5 of them went to the ER within 30 days of delivery for reasons including preeclampsia, postpartum cardiomyopathy, and infection. In conclusion, addressing factors that African American women experience throughout their pregnancy, childbirth, and postpartum period will benefit both the patients and the providers in the end.